Hello everyone. I am Dr. Sandeep Vaghulde. Today, I will be discussing Unit 4 National Health Programs in Social and Preventive Pharmacy for Final Year B Pharm in Semester 8. Today, we will be discussing National Health Programs, its objectives, functioning and outcomes. Total marks allotted for this topic 18 marks as per the blueprint of University of Mumbai. Various national health programs including National Health Intervention Program for Mother and Child, National Family Welfare Program, National Tobacco Control Program, National Malaria Prevention Program, National Program for the Health Care for the Elderly, Social Health Program, Role of WHO in Indian National Program. The National Health Intervention Program for Mother and Child in India includes programs like Janani Suraksha Yojana, JSY, Janani Shishu Suraksha Karyakram, JSSK, and Pradhan Mantri Surakshit Matritva Abhiyan, PMSMA. These programs aim to reduce maternal and infant mortality. Introduction to the National Health Intervention Program for Mother and Child in India. Health status of mother and child are prime indicator of assessing health situation of a country. Mothers and children not only constitute a large group, but they also vulnerable or special group. They comprises 71.4% of population of developing countries, Bangladesh, India, Nigeria. So mother and children are the foremost priorities of community health program. In India, women of childbearing age, 15 to 44, constitute 22.2% and children under 15 years of age about 35.5% of total population. India accounts nearly 20% of the world's child deaths. 880,000 newborns die in the first month of life. Nearly 1,600,000 children in total die each year before they turn 5. Maternal and child health services were first organized in India in 1921 by a committee of the Lady Chelmsford Logue, which collected funds for child welfare and established demonstration services on an all-India basis. Most common causes of maternal death in India. 1. Hemorrhage, 34%. 2. Abortion, 8%. 3. Hypertensive disorder, 5%. 4. Obstructed labor, -5%. 5. Sepsis, 12%. 6. Other, 34%. Maternal and child health care refers to, according to WHO drafted in 1976, promotive, preventive, curative, and rehabilitative health care for mother and children. Ministry of Health and Family Welfare, Government of LNDA has launched a new initiative namely SUMO, Surakshit Matritva Ashwasan, with an aim to provide assured, dignified, respectful and quality health care at no cost and zero tolerance for denial of services for every woman and newborn visiting the public health facility in order to end all preventable maternal and newborn deaths and morbidities and provide a positive birthing experience. The expected outcome of this new initiative is zero preventable maternal and newborn deaths and high quality of maternity care delivered with dignity and respect. Following this strategy, the Maternal Health Division strives to provide quality services to pregnant women and their newborns through various interventions and programs, building capacity of health personnel and routine health systems strengthening activities. Maternal health. Janani Shishu Suraksha Karyakram, Janani Suraksha Yojana, Dakshata Implementation Package, Pradhan Mantri Surakshit Matritva Abhiyan, Labor Room and Quality Improvement Initiative. Areas of work including Janani Suraksha Yojana, JSY, which is a demand promotion and conditional cash transfer scheme, was launched in April 2005 with the objective of reducing maternal and infant mortality. It is being implemented with the objective of reducing maternal and neonatal mortality by promoting institutional delivery among poor pregnant women. Government of India has launched Janani Shishu Suraksha Karyakram (JSSK) on 1st June 2011, which entitles all pregnant women delivering in public health institutions to absolutely free and no expense delivery, including caesarean section. Carrying forward the vision of our Honorable Prime Minister, the Pradhan Mantri Surakshit Matritva Abhiyan was launched in 2016 to ensure quality antenatal care and high-risk pregnancy detection in pregnant women on 9th of every month. In order to further accelerate decline in maternal mortality ratio (MMR) in the coming years, Ministry of Health and Family Welfare (MOFHW) has recently launched Lakshya Labour Room Quality Improvement Initiative. Lakshya program is a focused and targeted approach to strengthen key processes related to the labour rooms and maternity operation theatres, which aims at improving quality of care around birth and ensuring respectful maternity care. Other programs. Comprehensive abortion care. This program is implemented as per the mandates of the Medical Termination of Pregnancy Act. Medical Termination of Pregnancy Amendment Act and Rules 2021, the MTP Act 1971 recognized the importance of providing safe, affordable, accessible and legal abortion services to women who need to terminate a pregnancy due to certain therapeutic, eugenic, humanitarian or social grounds. The Act was amended for expanding the base of beneficiaries to provide safe abortion services. The National Family Welfare Program, NFWP, is a long-standing program in India aimed at promoting family planning and reproductive health services. The program was initiated in 1952, and since then, it has undergone several changes to meet the changing needs of the population. Over the decades, the program has undergone transformation in terms of policy and actual program implementation, and currently being repositioned to not only achieve population stabilization goals but also promote reproductive health and reduce maternal, infant and child mortality and morbidity. The objectives, strategies and activities of the Family Planning Division are designed and operated towards achieving the family welfare goals and objectives stated in various policy documents: NPP, National Population Policy 2000, NHP, National Health Policy 2017, and NHM, National Rural Health Mission, and to honor the commitments of the Government of India, including ICPD, International Conference on Population and Development, MDG, Millennium Development Goals, SDG, Sustainable Development Goals, and others. Factors influencing population growth can be grouped into following three categories. Unmet need of family planning. This includes the currently married women who wish to stop childbearing or wait for next 2 or more years for the next childbirth, but not using any contraceptive method. Age at marriage and first childbirth. In India, 23.3%, National Family Health Survey, that is NFHS 5, of the girls get married below the age of 18 years, and out of the total deliveries, 6.8% are among teenagers, that is 15 to 19 years. Spacing between births. Healthy spacing of 3 years improves the chances of survival of infants and also helps in reducing the impact of population momentum on population growth. Strategies under Family Planning Program in the country. Two main strategies or levels like policy level and service level. Policy level includes following. Target-free approach. Voluntary adoption of family planning methods. Based on felt need of the community. Children by choice and not chance. Service level includes following. More emphasis on spacing methods. Assuring quality of services. Expanding contraceptive choices. Current family planning program under public sector. Two main categories or methods like spacing method and limiting method. First method is spacing method includes IUCD, that is simple intrauterine contraceptive device 380A, and CUIUCD, that is copper intrauterine contraceptive 375. Injectable contraceptive MPA comes under Antara program. Combined oral contraceptive Malaria. Senchroman, Chaya. Condoms, Nirod. Second method is limiting method includes female sterilization, laparoscopic, minilap, male sterilization, no scalpel vasectomy, conventional vasectomy, and two emergency methods like emergency contraception and emergency contraceptive pills, EZY pills. The National Tobacco Control Program, NTCP, was launched by the Government of India in 2007 to reduce tobacco use and its harmful effects. The aim is to create awareness about the harmful effects of tobacco consumption and reduce the production and supply of tobacco products. Government of India launched the National Tobacco Control Program, NTCP, in the year 2007-8 during the 11th five-year plan, with the aim to create awareness about the harmful effects of tobacco consumption. 2. Reduce the production and supply of tobacco products. 3. Ensure effective implementation of the provisions under the Cigarettes and Other Tobacco Products, Prohibition of Advertisement and Regulation of Trade and Commerce, Production, Supply and Distribution, Act, 2003 COTPA. 4. Help the people quit tobacco use and facilitate implementation of strategies for prevention and control of tobacco advocated by WHO Framework Convention of Tobacco Control. The main thrust areas for the NTCP are as under. Training of health and social workers, NGOs, school teachers and enforcement officers. Information, education and communication, IEC activities. School programs. Monitoring of tobacco control laws. Coordination with Panchayati Raj institutions for village-level activities. And setting up and strengthening of cessation facilities, including provision of pharmacological treatment facilities at district level. National Tobacco Control Cell, NTCC. NTCP is implemented through a three-tier structure, that is. First is National Tobacco Control Cell, NTCC, at central level. Second is State Tobacco Control Cell, STCC, at state level, and third is District Tobacco Control Cell, DTCC, at district level. There is also a provision of setting up tobacco cessation services at district level. The National Tobacco Control Cell, NTCC, is a government office in New Delhi that plans, implements, and monitors the National Tobacco Control Program, NTCP. The NTCP works at the national, state, and district levels. The NTCC provides operational guidelines to state governments and district administrations. Tobacco control at the district level, that is District Tobacco Control Cells, DTCCs, are established to implement and monitor tobacco control initiatives. The National Malaria Control Program, NMCP, is a program in India that aims to eliminate malaria from the country. The program was launched in 1953. History of malaria control in India. In 1947, At India's independence, 22% population of country was estimated to suffer from marking with 75 million cases and 0.8 million deaths due to malaria annually. To combat devastating effects of malaria, the National Malaria Control Program, NMCP, was launched in 1953 built around three key activities: insecticidal residual spray, IRS, with DDT, monitoring and surveillance of cases, and treatment of patients. Malaria-related morbidity and mortality in India rapidly brought down within a few years. Encouraged by the program's success, it was converted to National Malaria Eradication Program, NMEP, in 1958. In April 1953, Government of India launched a National Malaria Control Program, NMCP, with the following objectives. First objective is to bring down malaria transmission to a level at which it would cease to be a major public health problem. And second objective and achievement was to be maintained by each state to hold down the malaria transmission at low level. Strategies under NMCP. First is principal operational activities under the control program comprised of residual insecticide spray of human dwelling and catty sheds. Second is malaria control teams were organized and directed by the state anti-malaria organization to monitor the malaria incidence in the control areas. And third is antimalarial drugs were made available for patients reporting to an institution. Modified Plan of Operation. In 1977, attempts at malaria eradication were given up, and under the review policy a modified plan of operation was adopted with following objectives. 1. Elimination of malaria deaths. 2. Reduction of malaria morbidity. 3. Maintenance of the gains achieved so far by reducing transmission of malaria. India's malaria action programs include implementation of revised control strategy, Enhanced Malarial Control Project, which is launched in April 1997, and revision and/or implementation of Anti-Malarial Drug Policy 1982. The Insecticides Act of 1968 and the Insecticides Rules of 1971 regulate the use, sale, and distribution of insecticides in India. The policy aims to protect people and animals from the risks of insecticides. Milestones of the program. National Malaria Control Program, NMCP, implemented in 1953. National Malaria Eradication Program, NMEP, implemented in 1958. Modified Plan of Operation, MPO, implemented in 1977. Multipurpose Worker Scheme, MPWS, implemented in 1979. Implementation of Malaria Control Project, MCP, implemented in 1997. Enhanced Malaria Control Project, EMCP, implemented in 1995. National Anti-Malaria Program, NAMP, implemented in 2000. National Vector-Borne Disease Control Program, NVBDCP, implemented in 2004. The National Program for Health Care of the Elderly, NPHCE, is a program that provides health care to senior citizens in India. The program is run by the Ministry of Health and Family Welfare. National Program for Health Care for Elderly was launched in 2010. EFC, that is Education Finance Council, for an amount of 288 crores rupees including 20% of state share, was approved in June 2010 for the remaining period of 11th plan. The program is state-oriented, and basic thrust of the program is to provide dedicated health care facilities to the senior citizens, more than 60 years of age, at various levels of primary health care. Objectives of National Program for Health Care for Elderly. To provide accessible, affordable, and high-quality long-term, comprehensive and dedicated care services to an aging population. Creating a new architecture for aging to build a framework to create an enabling environment for a society for all ages. To promote the concept of active and healthy aging. Convergence with National Rural Health Mission, Ayush and other line departments like Ministry of Social Justice and Empowerment. Expected outcome of program. Setting up of 325 district geriatric units with dedicated geriatric OPD and 10-bedded geriatric ward in 80 to 100 district hospitals by the end of 12th plan period. Setting up of biweekly geriatric clinics and rehabilitation units in all community health centers of selected districts. Strengthening all subcenters of selected districts to provide with equipment for community outreach services. Provide training to staff of public health care system in geriatric care. National Program for Health Care for Elderly Program Organization. Institutional framework includes integration with NRHM, Constitution of State Health Society (SHS), Constitution of District Health Society (DHS). Package of services. Sub-center is health education and home-based care to bedridden elderly persons and provide training to the family health care providers in looking after the disabled elderly persons. Primary Health Center is conducting weekly geriatric clinic health assessment of the elderly persons and simple investigation including blood sugar, etc. Community Health Center is conducting bi-weekly geriatric clinic, organizing rehabilitation services, domiciliary visits by the rehabilitation worker for bedridden elderly and counseling to family members for care such patients. District hospitals is dedicated geriatric OPD services, indoor admissions through 10-bedded geriatric ward, laboratory investigations and rehabilitation services. Regional geriatric centers which providing tertiary care services through OPD and indoor admission in 30-bedded ward, development of specialized human resource through MD courses in geriatric medicine as well as research. Social health programs work to improve the health of a population by addressing social factors that affect health. These programs can help reduce infant and maternal mortality, increase life expectancy, and reduce disease. The World Health Organization, WHO, supports the Government of India's efforts to improve the health of its people through technical support and expertise. The primary objective of whose involvement in Indian national programs is to support the Government of India's efforts to improve the health status of its population. This involves strengthening the healthcare infrastructure and systems, providing expertise and technical support for disease control and elimination. What is WHO? World Health Organization, WHO, is the United Nations Specialized Agency for Health. It is an intergovernmental organization and works in collaboration with its member states usually through the Ministries of Health, whose global office is located in Geneva, Switzerland. The World Health Organization is responsible for providing leadership on global health matters, shaping the health research agenda, setting norms and standards, articulating evidence-based policy options, providing technical support to countries and monitoring and assessing health trends. India became a party to the WHO Constitution on 12 January 1948. The first session of the WHO Regional Committee for Southeast Asia was held on 4 to 5 October 1948 in the office of the Indian Minister of Health. WHO in India as Country Cooperation Strategy 2019 to 2023, a time of transition. It has been jointly developed by the Ministry of Health and Family Welfare, MOHFW, of the Government of India and the WHO Country Office for India. The Country Cooperation Strategy, CCS, provides a strategic roadmap for WHO to work with the GOI towards achieving its health sector goals, improving the health of its population and bringing in transformative changes in the health sector. The period of this CCS is expected to bring rapid and significant changes to India's health sector and to improve access to quality health care, especially to the vulnerable and underserved populations. Strategic priorities of WHO in India. Strategic Priority 1. Accelerate progress on UHC. Implementing Ayushman Bharat, Health and Wellness Centers and Hospital Insurance Scheme. Monitoring and evaluation of health sector performance. Improving access to priority health services such as immunizations, maternal and child health, tuberculosis, hepatitis. Digital health ecosystem. Eliminating neglected tropical diseases and control of vaccine-preventable and vector-borne diseases. Strategic priorities of WHO in India. Strategic Priority 2. Promote health and wellness by addressing determinants of health. Non-communicable diseases, NCDs, action plan rollout. Environmental health, including air pollution. Mental health promotion and suicide prevention. Nutrition and food safety. Road safety. Tobacco control. Integration of NCD and environmental risk factors in the digital health information platform. Strategic priorities of WHO in India. Strategic Priority 3. Better protect the population against health emergencies. Disease surveillance and outbreak detection and response, including international health regulation. Rollout of Integrated Disease Surveillance Program using the Real-Time Integrated Health Information Platform, IHIP. Preparedness for and response to all emergencies. Containment of antimicrobial resistance. Strategic priorities of WHO in India. Strategic Priority 4. Enhance India's global leadership in health. Improving access to medical products of assured quality made in India. Development and information sharing of innovations in health practices and technologies including IHIP. Strengthening India's leadership in digital health.